Hi, rabbits. Research Turtle here. Today, we are decoding AstraZeneca. This is a company standing at a massive crossroads. On one side, they have a scientific peak, aiming for $80 billion in revenue. On the other side, they face a geopolitical crisis in China that threatens to derail everything. Let's dive into the path to $80 billion. First, let's look at the Ambition 2030. Right now, AstraZeneca sits at roughly $49 billion. Their goal is to nearly double that to $80 billion by 2030. How? By fundamentally changing their DNA. They are shifting from a legacy of primary care medicines to a future dominated by specialty care, specifically oncology, rare disease, and biopharma. They plan to launch 20 new medicines in just 6 years. That is aggressive growth. But growth needs stability. Historically, AstraZeneca had heavy exposure to China. But notice this strategic realignment. They are pivoting their center of gravity to the U.S. They are injecting $3.5 billion into manufacturing and R&D in Texas, Virginia, and Maryland. Why? To de-risk. In the era of the Biosecure Act, they need the U.S. market to drive over 50% of their future growth. This is about insulating the enterprise from geopolitical shocks. Now, let's talk about the engine room, oncology, specifically ADCs, antibody-drug conjugates. They already won the war in HR2 low breast cancer with Enhertu. That's the legacy. The future is Dato-DXd. This targets TROP2. They are moving from carpet-bombing cancer to using precision AI snipers. However, the path hasn't been smooth. Look at the lung cancer conflict. The Tropion-Lung01 trial was a statistical miss in the all-comer population. The survival benefit wasn't clear, but here's the plot twist. AstraZeneca isn't giving up. They're using AI biomarkers called QCS-NMR. When they use AI to filter patients, the risk of death drops by 43%. They're trying to rescue a multi-billion-dollar drug with algorithms. All eyes are now on the Avanzar Phase 3 trial. That is the catalyst that unlocks the first-line lung cancer market. In breast cancer, the story is stronger. Dato-DXd is outperforming competitors like Trodelvy, showing a better safety profile, less severe diarrhea and neutropenia. And keep an eye on camizestrant. This is their hormone pivot. Instead of waiting for a tumor to grow back, they're using liquid biopsies to detect mutations early and switch drugs before the cancer progresses. This early switch strategy could rewrite the protocols. Now, let's shift to the hottest topic in pharma, weight loss. Everyone talks about Novo Nordisk and Eli Lilly, but AstraZeneca is playing a different game. The current market is a red ocean of injectables with supply shortages. AstraZeneca is aiming for the blue ocean of oral small molecules. Meet AZD5004. This isn't a complex biological injection, it's a pill, a small molecule. That means no cold chain logistics and it's much cheaper to manufacture. If they can match the efficacy of competitors, around 2% A1C reduction, with a simple pill, they become the disruptive third player in a $100 billion market. And they aren't stopping at just weight loss. They want quality weight loss. By combining GLP-1 with amylin, they aim to burn fat while preserving muscle. Also, look at baxdrostat for hypertension. It targets the specific enzyme causing high blood pressure without messing up your cortisol levels. That is precision cardiology. Let's look at the cash cow, rare disease. This is the fortress built by acquiring Alexion. The strategy here is defense. They are moving patients from IV infusions, Soliris, to long-acting shots, Ultomiris, and soon to at-home self-injections with Gefurulimab. This creates a durable moat against generics and the IRA. But we have to address the elephant in the room, the geopolitical shadow. China represents 13% of AstraZeneca's revenue. Currently, they are facing investigations regarding insurance fraud and illegal imports. With their China president detained, there's a real risk of exclusion from government purchasing programs. This is the single biggest drag on the stock right now. So, how do we value this giant? AstraZeneca trades at a premium, around 18 times earnings, compared to Pfizer's 10 times. Why? Because of the innovation premium. The market is pricing in those 16 Phase 3 wins. Here's the thesis. If the China risk blows over and the obesity pipeline delivers, that premium is justified. If China growth hits zero, the stock could derate significantly. Finally, mark your calendars. The second half of 2025 is the hot zone. We're waiting for two massive cards to flip, the Avanzar lung cancer data and the AZD 5004 obesity data. These two readouts will likely decide the direction of the stock for the next couple of years. In conclusion, the turbulence is temporary, but the science and the risk is permanent. It's a high-stakes game of innovation versus geopolitics. That's it for today. Turtle out.